Bismillahirrahmanirrahim. Our today's lecture will revolve around Helicobacter pylori, uh, which causes chronic gastritis. When we talk about Helicobacter pylori, it is a curved bacilli, or you can say that it is a spiral-shaped bacilli, and it is present in the duodenal ulcers, and also you can isolate this H. pylori from gastric ulcers. H. pylori it is associated with overcrowded places. It is associated with those people who are living in rural areas, who are having poverty. It has strong association with poverty, and there is strong association of this H. pylori with American and African population. Humans, they are the main or the primary carriers, and the main route of transmission of H. pylori, that is fecal-oral route. If we talk about the pathogenesis of this H. pylori, usually it presents with classical symptoms of the gastritis, and the gastritis in case of H. pylori infection, it involves the antral region of the stomach. Uh, The gastritis, it may result in increased production or increased secretion of the acid. Sometimes the acid secretion, it may remain normal. There are 1 to 2 points which should be noted here. One is about the acid secretion. Second is about the gastrin production. The localized gastrin production, the local gastrin production in the stomach, it may be increased, uh, but hypergastrinemia, or the increased secretion of the gastrin in the blood or in the serum, that is uncommon, that is not noted. So ये तीन चीज़ें हैं. ये लेक्चर के बाद हम नेक्स्ट लेक्चर जब करेंगे ऑटो इम्यून गैस्ट्राइटिस का, तो उसके एंड पे हम एक टेबल देखेंगे, कंपैरेटिव टेबल होगा गिविंग अ डिटेल कंपैरिजन ऑफ दिस H. pylori gastritis and autoimmune gastritis. You people will come across these few important differences in that table. So acid production may be increased or it may remain normal. There is increased local gastrin production, but overall hypergastrinemia, or increased production, increased secretion of the gastrin in the serum, that is uncommon. There are various host factors uh, that are associated or that may result in the um, development of this H. pylori infection. And the two important host factors, they are duodenal ulcers, and apart from the duodenal ulcer we have the gastric ulcer. So they are the H. pylori gastritis is very strongly associated with these two types of the ulceration. When we talk about the pathogenesis, when we have to mention the various virulence factors of H. pylori that are that mainly help this organism in invading the gastric mucosa. So there are four important virulence factors, starting off with the flagella, which helps in the motility of the bacteria. Then there is production of the urease enzyme. Urease is very important, which elevates the gastric pH. How it elevates the gastric pH? Because it generates the ammonia from the urea, and ultimately when ammonia is generated, it has a basic nature, and as a result the pH that is elevated. Then it has adhesins, and these adhesins they help in adherence of the bacteria to the gastric mucosa. And then it causes production of various toxins, especially the CAG-A toxin, that can help in the spread or the progression of the disease. So these are the four important virulence factors that must be mentioned in the pathogenesis, starting off with the flagella, production of the urease enzyme, then the production of adhesins protein, and the toxins, especially CAG-A. This about this toxin CAG-A. CAG-A, it is associated with almost majority of the H. pylori associated gastritis. जितने भी हम उसमें से isolates which we separate from the gastric mucosa, if we test them for the various virulence factor, CAG-A is present in about 90% of the H. pylori isolates. So it means that it is very consistent feature of the H. pylori associated gastritis, that the H. pylori produces very consistently produces CAG-A toxin. So this is the picture of this H. pylori that shows a spiral shaped or bacilli, spiral shaped bacilli, or curved microorganism or curved bacilli that is invading the epithelial surface of the gastric mucosa. This is endoscopic view of the gastric mucosa showing hyperemia and development of the ulcerations. So this is a microscopic picture of gastric mucosa showing various uh, features that can be seen in H. pylori infection, especially in this insert picture. You can see these curve shaped organisms that have been stained by the silver stain. These are dark brownish in color. Uh, and apart from these microorganisms, you can see numerous other features, especially there is a presence of these inflammatory cells. The inflammation is so much severe that it has resulted in the formation of this lymphoid follicle or aggregate of the lymphoid cells. This round structure that is being displayed in the center of the picture and denoted by this red ink. So the inflammation can be so much severe that it can result in the development of lymphoid structure. The organism is mainly concentrated in the superficial epithelial cells. uh, they they reside on the superficial layers of the epithelial cells. However, they can also invade the epithelial cells downwards, but usually they remain on the superficial surface of these epithelial cells. Another picture, closer view of H. pylori of this gastric mucosa. Now the arrowheads, they are denoting the H. pylori microorganism, which are bacilli, curved bacilli or spiral shape. Previous picture was not that much clear if uh, we talk about the hematoxylin and eosinophil stain. While in this picture, the hematoxylin and eosin stain, they are denoting these H. pylori microorganisms which are present in the glandular lumen and present at the surface of the epithelial cells. Apart from the demonstration of these H. pylori microorganisms, we can see in a variety of inflammatory cells, especially the neutrophils. We can also find the intraepithelial inflammatory cells, like we can get the plasma cells. Plasma cells, they are usually present beneath the epithelial surface, so they will be called as subepithelial plasma cells. The neutrophils, they may be seen inside the epithelium. Inside the epithelial cells, they will be called as intraepithelial neutrophils. Apart from these two important types of the cells, we will also find the lymphocytes and the macrophages. So these are the important things. If we look at the previous picture, in which I showed you that there is a large lymphoid follicle that is present in the central area. So that lymphoid follicle, it can give rise to the mucosal associated lymphoid tissue lymphoma or malt lymphoma that can arise in the GIT due to long-standing H. pylori infection. So another close view of this H pylori microorganism on this silver stain. Now you can see that the microorganism, H. pylori microorganism, it is carpeting whole of the gastric mucosa at this point where it is marked with this ink. So it is carpeting whole of the gastric mucosa in a single gland. So if once you have got this gastritis, you should eat smaller meals. You should include more protein, fresh fruits and vegetables in your diet. You should not use spicy food, caffeine. Stop smoking. Avoid alcohol as it is prohibited in Islam. So this is the important thing about the last slide: fresh fruits and vegetables, and stop the spicy foods. So this was the lecture about H. pylori gastritis. इसमें शायद हाँ clinical features अगर देख लें, clinically how will diagnose this H. pylori gastritis. Serological tests हैं, ब्लड लेके उसमें हम उसकी एंटीबॉडी लेवल मेजर करते हैं, जैसे आजकल कोविड के लिए बड़ा कॉमन चल रहा है. Secondly, we can get the urease breath test, urea breath test, that is also important. How it is treated, medicine वाले ज़्यादा बेहतर जानते हैं. They can tell you people better that they give various antibiotics, especially this amoxicillin or clarithromycin, along with metronidazole and a combination of the PPI. So वो 2-3 हफ्ते का एक पूरा course है that has been done for the eradication of this H. pylori. So in the next lecture we'll discuss with the autoimmune gastritis.